afternoon. I'm Khalees Tennille, and I chose to do my case study on Florence Nightingale's environmental theory. I chose this theory because it focuses on a patient having the optimal environment that promotes healing. I used to be a home health nurse. I did home health for the past 5 years, and I know that with the environmental theory, it can be applied a lot more easily in a hospital setting, but it also applies to a home health setting as well because patients still need the optimal environment to heal, but sometimes nurses don't have as much control in the home. So for my case study, I chose a patient, a 65-year-old male that was referred to us by a wound care physician in Tifton. The patient had diabetic foot ulcers to the bottom of both feet and also had chronic lymphedema. I was the starter care nurse. I went out to do my admission assessment on the patient and noted that the patient lived in public housing apartments. He lived by himself. He had risk care aides that were supposed to be coming in to like homemaker services that were supposed to come in 5 days a week to make sure his house was clean, his clothes were washed, because he wasn't able to really do that type of thing for himself. Patient has a history of hypertension, diabetes, hyperlipidemia, and lymphedema. Um, Noted that the patient had honey buns and cookies on the table, so he wasn't compliant with his diet. Hadn't been checking his blood sugars at home, even though he did have a blood sugar machine. The doctor became concerned when the patient would go in for his appointments and his clothes would be dirty, would have a foul odor. He just wasn't being kept the way he should have been. And there had been a situation where the patient went in to see the doctor, and when they got ready to cut the Una boots off, there were maggots in the Una boots that weren't medical maggots. So we went out, did an assessment. We did call and make a complaint with Rest Care, and we spoke with the manager and said that his home health aide said that the patient had been refusing baths at times. So we educated the patient on the importance of daily hygiene to promote wound healing and a clean environment. And the manager at Rest Care said she would definitely take care of that. So the nurse collected information during her assessment and took it back to the interdisciplinary team at the home health service and discussed concerns. So the nurse and two of her coworkers went back to the patient's house 2 days later. They went and bought cleaning supplies, a fresh set of linens for the patient out of their own money. They went in on their own time, cleaned up the patient's apartment, got it up to par for living. The patient did have a shower chair. We were able to get him into the shower, get a good bath, clean sheets and everything on the bed, just get his apartment cleaned up. And what we found that after this happened, the patient started feeling a lot better. He wanted to become more compliant with checking his blood sugar, wanted more education on his diet, and all of that was because his environment at home changed. A lot of times patients don't have the financial resources because a lot of these patients are on fixed incomes, and for them it comes down to, are they going to buy their medication, or they don't have extra money for anything else. But by us just assessing the situation, chipping together, and helping this patient get a good bath and make sure his home was clean, he had great outcomes from it. And he also began being compliant with getting the baths from the Rest Care aide. So in the end, it took about 4.5 months. The ulcers didn't completely heal. They got a whole lot better. His lymphedema was better. So the goals were met and the doctor was satisfied, and the patient had a great experience.